You leave the clinic clutching a piece of paper that says normal, but your head is pounding and you can't get off the couch. You whisper to yourself, if the tests are normal, why do I still hurt? And no one seems to have an answer. I get those calls. Here's a practical path forward.
Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started. Quick heads up before we dive in. I'll explain why tests can be normal and symptoms persist, give a stepwise plan you can use, and share exact phrases to help clinicians take you seriously. I won't catalog every rare disease. This is practical triage, not an exhaustive diagnostic guide. If you're having severe chest pain, sudden weakness, trouble speaking, sudden vision change, or severe shortness of breath, seek emergency care now. Safety first. So why does normal sometimes feel like a dead end? First, I want you to know normal is a statistical label. Reference ranges describe population averages, not your personal baseline. A value at the high end for you might still be within the lab's range, but could mean something for how you feel. Second, timing matters. Tests are snapshots. Hormones ebb and flow, infections can be intermittent, and inflammatory markers can rise and fall. If we test at the wrong moment, we miss the signal. Third, imaging and labs have limits. An MRI won't always show early nerve irritation, and many autoimmune conditions start without classic lab changes. Lastly, non-biomedical drivers, sleep, mood, stress, work, or family strain, can amplify real physical symptoms. All of this means normal isn't the same as nothing is wrong. Let me give you practical categories I see most often. Metabolic and endocrine issues, like subtle thyroid or blood sugar changes. Early autoimmune or inflammatory problems that are patchy. Functional disorders, such as fibromyalgia or dysautonomia that affect how systems work. Medication side effects or interactions, and sleep or mental health conditions that worsen every other symptom. Often it's a combination. Here's a nurse-tested stepwise approach that cuts down on noise and focuses on what's useful. First, start a focused symptom diary. Note date, time, activity, symptom, intensity 0 to 10, possible triggers, and what you tried. Patterns are diagnostic gold. Second, prefer targeted repeat testing over shotgun panels. If your tiredness spikes mid-afternoon, a fasting glucose or an HbA1c is more informative than a single random test. If symptoms are cyclical, time labs to when you're symptomatic. Third, prioritize referrals. Ask, which specialist will most likely move this forward? A focused rheumatology or neurology consult is usually better than being bounced between clinics with repeated normal results. Fourth, consider safe, time-limited trial treatments when appropriate. Sleep hygiene and a supervised sleep study. A short CBT referral for insomnia or anxiety, or a cautious medication adjustment under supervision. Document outcomes in your diary so you can judge benefit objectively. Fifth, monitoring and scheduled follow-up. For many non-urgent conditions, watchful waiting with a reassessment planned at 4 to 6 weeks prevents unnecessary tests while keeping the issue on your clinician's radar. Communication is where patients get traction. I'll be blunt. How you talk about this matters. Clinicians respond to concise, actionable statements more than long emotional monologues. I appreciate the tests you ordered. My labs came back normal, but I'm still having X every day for Y weeks, and it's changed my day to day. I say this because I've seen it cut through dismissal. Follow with one targeted ask. Can we time my next test to when symptoms are worst?
try treatment B for 4 weeks, or refer me to specialist C. Simple, specific, and trackable. Also ask for a timeline. Can we reassess in 4 to 6 weeks? That turns vague reassurance into accountable follow-up. Bring a 1-page summary to visits, recent labs and imaging reports, medication list with doses, and your symptom diary. That 1 page saves time and reduces repetition across providers. Now, safety and self-management. Quick and concrete. Pacing matters. Break tasks into small chunks and alternate activity with rest to avoid boom and bust cycles that set you back. Prioritize sleep, consistent bedtime, screen curfew, and a wind-down routine.
Avoid driving if you have unexplained fainting or severe dizziness until a clinician clears you. Use a simple tracker. Date, time, symptom, intensity, likely trigger, what you tried, and the effect. It's low-tech and highly effective.
Let me list red flags one more time. These need immediate evaluation. Chest pain with pressure or shortness of breath, sudden severe headache or vision changes, new one-sided weakness or numbness, sudden trouble speaking, very high fevers, or signs of sepsis like very fast heart rate or low blood pressure. If any of those occur, seek emergency care now. Before we close, 3 clear, usable takeaways you can use today. First, start a focused symptom diary. Patterns are diagnostic gold. Second, ask for one specific next step and a reassessment timeline. This prevents getting bounced around. Third, prioritize safety. Know the red flags and seek immediate care if they appear. Bonus, bring a 1-page summary of meds, tests, and your symptom timeline to every visit. If you want the templates I use with patients, a symptom tracker, a 1-page visit summary, and sample scripts, you'll find them in the show notes at faqbynurseJessicaconsulting.com/episodes. Use them to create a focused conversation with your clinician that moves towards answers, not more confusion.
Thanks for spending this time with me. If today's episode helped you feel a little less stuck or gave you practical things to try, please subscribe so future episodes reach people who need straightforward, nurse-led guidance. And if you have a question you'd like me to tackle, send it through the contact link in the show notes. Until next time, stay informed, stay compassionate, and always put safety first. Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at faqbynursejessinsights.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.